Hi, I'm Dr. Michael Zona from the Zona Profiles. A new study recently came out on intentional poisonings. This is a study of all emergency room admissions from 2009. They collated almost 15,000 admissions. Now, this is not accidental poisonings, which oftentimes you might see a child reporting to the emergency room with their parents, and the child had gone into something. These are intentional poisonings. And it's not the intentional poisonings that you might see, say, a Columbo episode on television, or the stuff of detective novels. This is intentional poisoning that is happening across America of drinks or food. These 15,000 admissions to the emergency room represent just the tip of the iceberg of this phenomenon. What's even more alarming is that the majority of the people who came to emergency rooms had a combination of intentional poisoning, alcohol, and drugs of abuse, which can often lead to a very fatal situation, respiratory depression, and death. Furthermore, it's hard to help these folks, victims who come into the emergency room, because oftentimes the doctor doesn't know, nor does the patient, exactly what they've been given. There's an expression that I used to hear when I was younger, and it went something like this, and it had to do with intentional poisoning, where somebody would have their drink spiked, and they would say, oh, the person was slipped a Mickey, or the person was given a Mickey Finn. And what that relates to is a phenomenon that was occurring around the 1900s, early 1900s in Chicago. There was a fellow there by the name of Michael Finn who owned a bar, and he would give chloral hydrate to his barmaids, who would intentionally put the chloral hydrate into alcohol for their patrons. And then when the patron became intoxicated, they'd bring him in the back alley, rob him, and leave him in the back alley. And that was called slipping someone a Mickey. Nowadays, you hear from the popular press something called roofie or Rohypnol, and that's also known as a date rape drug. And people are using that instead of chloral hydrate that they used in the 1900s. Irrespective, you don't need a roofie or a Mickey Finn. You can also use just hardcore, high concentrated alcohol. Many times you'd want to find something that's odorless and colorless. You find those in punch bowls, for example, at various parties. People are using Ativan, people are using clonazepam or Xanax. They're intentionally spiking other people's drinks. I believe that the study only indicates the tip of the iceberg. I have had patients, and probably most of the people watching this video know others, friends or family, who've been spiked, who've been Mickeyed or roofied, and have found themselves intoxicated or sexually compromised because of being intentionally poisoned. Many patients are emotionally harmed, often for life. They feel guilty, they're victimized, they feel as if they've lost control over their lives. Many suffer from continued anxiety and depression. Now, obviously, we're not going to be able to catch every sexual predator, especially before the act. The best thing you can do to prevent yourself from being a victim is to follow some simple advice, some simple rules, so that you do not fall prey to these sexual predators who are out there and are intentionally spiking your drink or food. Here are some tips. 1, watch your drink being made. Don't order a gin and tonic and then turn your back and talk with your friends while the bartender or the person at the private party starts mixing your drink. Watch your drink being made. 2, never accept a drink from somebody who's coming to your table with a pre-made drink already mixed to hit on you. That's a recipe for disaster. 3, if you're getting up to dance, take your drink with you. The worst that can happen is a bouncer says, hey, no drinks on the floor, or somebody elbows you and you spill half of it. Chances are in a legitimate place, if you leave a drink on a table for too long and you're up drinking, you're up on the dance floor, the waitress is going to come and just clear it off your table anyway. So you might as well take it with you. If you take your drink with you, nobody is going to be able to spike it while you're out there dancing. Next, avoid places where this can occur. You're going to have a higher risk for this to happen in large meeting areas like a rave party, a disco, pickup joints, big college groupings of individuals, perhaps a fraternity or something where there's a community punch bowl that people are spiking. Avoid those places. In AA, there's an expression, if you don't want to slip, avoid slippery places. And the same is true in this scenario. Lastly, have a buddy. The best thing you could do for yourself is have a buddy system so that if you become impaired by hook or by crook, you know that your buddy can take care of you and vice versa. Do not, if you are the buddy of an individual who is far more intoxicated than it seems from what they had drank, be very careful. Make sure that if you're the buddy, you follow up on that responsibility and you take that person home. If you follow these simple rules, you can avoid intentional poisoning and prevent yourself from being a victim from these sexual predators who are out there and are actively engaged in intentional poisoning in order to take advantage of you. This is Dr. Michael Zona from the Zona Profile.